5 minutes writing time, 40 minutes, that that is the writing exact examination time for the OET writing exam. So as soon as we got the case note, we are going to look into what's important in the case note. Is the first important thing is you're going to read what is writing task. Okay,
Writing task.
so here in this case note you can see that writing task is clearly given that you are a first year resident in a surgical ward. Sally Fletcher is a 25-year-old woman who has recently undergone surgery. You are now discharging her from hospital. Okay, so using the information given to you in the case notes, write a letter of discharge to the patient's
Yes.
GP. That's the simplest letter you can write from this case note. This is a very simple letter, but from this one, you have to make your limited word limit is 180 to 200. You have to have a look on your word count because there are some limitations there when you check the case notes. Okay, so here we can elaborate two things first. So to whom we are writing?
Yes.
Patient's own GP. Okay,
Mm.
so this is patient's own GP and address is clearly given here. Okay, and we are writing a letter of discharge. Okay, so who is our
Yes.
patient? Our patient's name is already given. Sally
Yes.
Fletcher, 25-year-old woman who has recently undergone surgery. So we don't know what surgery now. So we're going to check in case notes. Okay.
Yes.
So consider this is your first 5 minutes. So you're just reading the case note and understanding your case note. Then you're going to classify your informations in the case note and you're planning. Then only you are going to write the introduction, then the first paragraph and second body paragraph and the conclusion. Yeah. So this is
Yes.
a smallest one, but there is only limited uh, notes you can take it as relevant in this case note. Okay, so when we come to notes, you can see patient was on which hospital is Fairbanks Hospital. The address is given and name of
Yes.
patient is Miss Sally Fletcher. Okay, date of birth is 3rd of October 1993. Marital status married 5 years after marriage now. So appointment date is on 25th of March 2018 and diagnosis is endometriosis. So this is all just the informations given in the case notes. So this is all
Yes.
important one. So you need to, because you need to mention the patient's date of birth and appointment date, the date of admission and diagnosis and all. Okay, so past medical history. My question is whether it is relevant or irrelevant
Yes.
in this case note. Is it relevant or
Uh,
irrelevant?
this is semi-relevant, but not clearly relevant because this patient is already comes from the GP, who is his own GP, own doctor. So he knows about the past history very well. So
Yeah,
he
so
can
this is,
say
you can
yes, it
say,
is not.
it is absolutely irrelevant because there is no semi-relevance in that past medical history because the patient's past medical history is aware by patient's GP, and if you are writing that again, that is going to, you have to pay back to you. Like, if you want to add that information to repeat the information that we already given, already know the patient's GP, may going to confuse the reader. So that's not going to give any points in your writing. So it is better to avoid that. Absolutely avoid that. That's why it is given that 2 points there. You pick up that one and do a wrong thing. Yeah. So social background, do we need to know this one or not? The patient's GP is aware or not?
Social issue aware, sure.
So we don't need the patient's GP is aware that she is an account and regular Western diet, exercise, and all. The patient's GP is well aware of that. So again, when it comes to medical background, okay,
mm,
so frequent acute menstrual pain localized to the lower left quadrant. So this is a
mm,
kind of semi-relevant because
very, mm,
this is
yes,
relevant to the current situation, current
mm,
condition that
yes,
we already
problem,
mentioned is that endometrial origin. So we can put it as a semi-relevant, and pain
mm,
persists despite taking OTC naproxen.
mm,
Okay, so when it comes to this thing, they already know that, patient's GP knows that patient is taking
mm,
naproxen. So you do not need
mm,
to mention exactly the same thing, but you can mention that this is also is, we can put it as a semi-relevant kind of thing.
mm,
Okay,
mm, mm, mm,
so we can say that. And shy discussing sexual history, so that's not
mm.
a point to discuss because
So much.
this should be definitely knowing by patients
Yes.
on GP, so you don't need to, because patients behavior definitely they may know it, so you don't need to discuss that. Yeah, occasional constipation associated with pain in lower left quadrant, you don't need to, because this is already known by the
Not
patients.
relevant.
Yes, not relevant. So that's important thing. Again, transvaginal ultrasound showing 6 centimeter cyst likely of endometrial origin. Okay, so the history. Then you are going to link the dots now. See, like endometriosis is here. Patient is admitted on this date. Okay. Then it comes to frequent acute menstrual pain localized to lower left quadrant. So then after admission we done a transvaginal, we didn't mention actually transvaginal ultrasound showed 6 centimeters is likely of endometrial origin. Okay, so therefore patient
Went to
underwent
ultrasound.
a laparoscopic surgery
Mm,
on the admission day itself, that is admission day. So it may be done before, but you can mention it as a semi-relevant because of that,
mm,
by the patient is admitting. Okay, so you can mention that just to support your information. Okay, so patient
mm.
recovering from post-op from laparoscopic surgery without any complications. Okay, so until
Yes.
here it
Yes.
is clear. It is a very simple case note, just I'm discussing this one first, then we will go and discuss your letter, how we are going to correct your letter, and this will be good for you for the next letters
Mm.
as well.
Yes.
Okay, so again,
Yes. Yes.
post-op
Mm.
care, keep incisions clean and dry. Is that relevant?
Mm.
Yeah,
Which
this
one?
is post-operative
Yes,
care.
this is relevant.
It is
This is
relevant
relevant.
because
Relevant.
after this, the patient's GP is not aware of what is happened to his patients on in during her hospitalization. So from here onwards, all are important points. So you can tick everything, mobility post-operatively, what's happened her mobility. So that's a question mark.
Mm.
So this you can consider. So showering is permitted on only on the next day. Okay, so driving is
Yes.
prohibited. So that's the one important concern. So when on analgesics, okay, so the patient is on
Yes.
analgesics, that we will come to that in a minute. Driving can be reassumed 24 to 48 hours after
Yes.
final dose of analgesics only,
Mm.
and sexual activity can be resumed after 2 weeks post-operatively. So
Yes.
all
Yes.
these are
Yes.
important points to discuss with the patient. And what are the nursing management? So we provided to the patient while the patient is in the hospital, that is another thing. So encouraged oral fluids, that is one point. Okay, so encouraged oral fluids, patient may return to regular diet. Okay, there is some changes in diet, but she can
Mm.
return to her regular diet after some time. Yeah,
Yes.
so
Yes. Yes.
ambulation encouraged as per patient's tolerance, that means it is related to mobility that we already discussed.
Yes.
So that
Yeah.
is again comes here, ambulation is encouraged as per patient's tolerance. Okay, so these are
Mm.
the
Mm.
important things. Then medical progress, still there is no temperature, a febrile, and HCT, HCB, platelets, WBC, BU, and creatinine, sodium, potassium, chlorine, all that, Cl,
Yes.
CO3,
Mm.
all these in normal limits. So you don't need to mention that
Yes.
because this is already on normal
Normal.
limits. And patient sitting comfortably, alert oriented. No, so it's so you can mention that patient is currently oriented to time, place, and situation. So the patient is ready
Mm,
for discharge. So you can mention that point while you're writing. You're going forward with that sentence. So then again,
mm,
yeah, since patient is oriented to person, place, time, and or situation, patient is ready for discharge. Along with overall progress is good. So discharge plan. What is the discharge plan? So we already discussed the writing task that we need to write a discharge letter
mm,
to the patient's GP. So here, for a patient to be discharged, one can eat, okay, ambulate,
yes.
and urinate independently. So patient is going to when patient is going to
Mm,
can be able to eat, ambulate, or move by herself and urinate independently, then
mm,
the patient is going to be discharged. So we don't know yet at the moment, but you are writing this letter on that point, okay? So important
yes.
thing, so
Yes.
that we don't know yet patient when the patient is going to discharge, yeah. Okay, so
Yes.
patient must be discharged to someone who can drive them home.
Yes.
So
Also important.
definitely this is the important thing. Definitely the
Mm,
patient can be discharged, must be discharged with someone who can drive them home.
mm,
So we need to arrange someone to come and drive her home. That is another thing. So you have to mention this to the GP, so then only GP can contact somebody and do that
yes.
properly. So these are the important points while we are discussing the case note.